Assalamu alaikum wa rahmatullahi wa barakatuh. Our seminar today about pathogenesis of acute inflammation. It is a very interesting topic took from general pathology, presented by me, Afrah Abdelrazaq, and my friend Amina Ammar and Amina Firas, supervised by Dr. Khalid Wissam. Our contents of seminar it is introduction about inflammation. What's inflammation? What's infection? Causes of inflammation. Cardinal signs of inflammation. Acute inflammation. It has two events, vascular events and cellular reaction. Now we'll start what's inflammation. Inflammation it is defined as the local response of living mammalian tissue to injury from any agent. But you must know, when any injurious agent, such as bacteria, virus, fungus, parasite, or anything, will enter to the human body, it will cause infection. So, you must distinguish inflammation from infection. Infection, it is ill effect by harmful microbes. These microbes, it may be bacteria, virus, fungi, parasite, or anything. How the body prevented and responded to this injurious agent, it is inflammation. So the inflammation it is a protective response by the body to variety of etiologic agent. This agent it may be infectious or non-infectious. Inflammation it is a body defense reaction in order to eliminate or limit the spread of injurious agent, followed by removal of necrotic cell and repair of damaged tissue. White blood cells or leukocytes are the body's major infection fighting cell. So the white blood cells is the army in the body. Causes of inflammation. Inflammation has 5 causes. Number 1. Infective agents like bacteria, virus, toxin, fungi, parasites. Number 2. Physical agents like heat, cold, radiation, and mechanical trauma. Number 3. Chemical agents like organic and inorganic poisons. Number 4. Immunological agents like cell-mediated and antigen-antibody reactions. Number 5. Inert materials, such as foreign bodies. Inflammation has two types, acute inflammation and chronic inflammation. When acute inflammation occurs in any part of the body, for example, in tonsillitis, will have 5 features. This is red in color, local increase in temperature compared with the surrounding tissue, increase in the size, pain, and temporary loss of function, so that the cardinal signs of acute inflammation in English is redness, in Latin rubor, heatiness, in Latin color, swelling, in Latin tumor, pain, in Latin dolor, loss of function, in Latin functiolasia. Now we'll take acute inflammation. It has two events, vascular events and cellular events. Now we'll take vascular events. It has 5 events. Number 1, transient vasoconstriction of arterioles. Number 2, resistance vasodilation. Number 3, elevated the local hydrostatic pressure. Number 4, increased vascular permeability. Number 5, slowing or stasis. Number 1, transient vasoconstriction of arterioles. Irrespective of what type of cell injury, immediate vascular response of a transient vasoconstriction of arterioles. Now look at the figure. The red in color is the blood vessels. The green in color is the white blood cell. White blood cell is the army in the body. Bacteria, when come to the near to the blood vessels, it is the vasoconstriction occur to the blood vessels. Immediate. In the mild injury, it takes about 3 to 5 seconds. In the severe injury, it takes about 5 minutes. Number 2. Persistent vasodilation. Mainly arterioles but also affected venules and capillary. Vasodilation results in increased blood volume, lead to rubor and color at the site of acute inflammation. Now look at the figure. In first step, vasoconstriction occurs to the blood vessels, and this step, vasodilation will occur in these blood vessels because the increased blood volume in the blood vessels that led to increased hydrostatic pressure in the blood vessels. Number 3. Elevated the local hydrostatic pressure. The hydrostatic pressure is outward and the oncotic pressure is inward. When the balance between hydrostatic pressure and oncotic pressure, there is no edema. When the hydrostatic pressure increases, because the increase of blood in the blood vessels, this led to edema, transudation. So the transudation of fluid to the extracellular space results in edema, swelling at the local site of acute inflammation. Now look at the figure. In normal state, hydrostatic pressure outward, the colloid osmotic pressure inward. The balance between hydrostatic pressure and colloid osmotic pressure, there is no edema. But when increase hydrostatic pressure and the decrease oncotic pressure, this lead to edema, transudate. The fluid will come out and with the protein. Now we continue with 4 steps of vascular events with my friends Amin Ammar.
Hi, my name is Amina Ammar. I will complete my colleague's explanation about vascular events in acute inflammation. Number 4. Increased vascular permeability. Increased vascular permeability is the hallmark of acute inflammation. This leads to escape of a protein-rich fluid, exudate, and leukocytes in extravascular space. Most affected vessels are venules. It is responsible for swelling, seen in acute inflammation. Leukocytes stick to the vascular endothelium, and they move and migrate through the gaps between the endothelial cells into the extravascular space. This process is known as transmigration. In this picture, at the normal state, plasma protein that will be found inside the blood vessels, but at inflammation state, the vasodilation that will be happen, increased interendothelial space, fluid and protein that will be leaked from blood vessels to the extravascular space. Number 5. Slowing or stasis. Increased concentration of red blood cells in small vessels that will be lead to reduced blood viscosity. In this picture, when the tissue that will be injured by the external influence, for example pain, that will be lead to release of chemical signals such as histamine, dilation and increased thickness of local blood vessels, migration of phagocytes to the area. Phagocytes include macrophages and neutrophils that will be lead to consume of the bacteria and cell debris. After that, the tissue become heals. The second main events occur in acute inflammation is cellular event. The main function of increased vascular permeability and stasis is to deliver leukocytes at the site of injury. Number 1, margination and pivementing. Number 2, ruling. Number 3, adhesion. Number 4, transmigration. Number 5, chemotaxis. Number 6, phagocytosis. This figure shows how the cellular events occur. Margination. The normal axial flow consists of central stream of cells, comprised by leukocytes and red blood cells, and peripheral cell-free layer of plasma close to the vessel wall. White blood cells leave the center and comes at periphery of a blood vessel. Reversal of the axial blood flow. The steps of margination and pivementing are slowing and stasis, central stream of cells widens. Then, losses of plasma by exudation, narrower peripheral plasma zone becomes. Then, as a result of this, redistribution. Then, neutrophils of the central column come close to the vessel wall. Then, reversal of the axial blood flow. After that, margination and pivementing happen. The endothelium can be lined by white cells, called pivementing, ruling peripherally marginated and pivemented neutrophils, slowly rule over the endothelial cells, lining the vessel wall due to transit bound between them.
Hi, I am Amina. I will continue with the transmigration. The transmigration is by formation of cytoplasmic pseudopod and damage the basement membrane by secretion of collagenesis and then escape to extravascular space. After the transmigration, the next step is chemotaxis. The chemotaxis is unidirectional oriented along a chemical gradient. Phagocytosis, engulfment of microbes by white blood cell eating, and called phagocyte. We have two types of phagocytic cells, the neutrophil, which appear early in the acute inflammation, and the monocyte, which is called macrophage. The step of phagocytosis: recognitions and attachment, engulfment, killing and degradation. Now, the engulfment. Engulfment is by formations of pseudopod around the particles, and then formation of phagocytic vacuoles when the vacuole is fused with the lysosome, formation of phagolysosome. Finally, killing and degradation by oxidative bactericidal mechanism, by oxygen-free radicals, or oxidative bactericidal mechanism by lysosomal granules, or by non-oxidative bactericidal mechanism. These are the reference of the seminar. Thank you for listening.